everyone, welcome back to MedLife. Today we are going to study about the brachial artery. It is the continuation of the axillary artery. It extends from the lower border of the teres major muscle to a point in front of the elbow at the level of neck of the radius just medial to the tendon of the biceps brachii. It runs downwards and laterally in front of arm. It crosses the elbow joint and ends at the level of neck of the radius in the cubital fossa by dividing into two terminal branches, that is radial artery and ulnar artery. Now let's see its relations. Anteriorly in the middle of the arm, it is crossed by the median nerve from lateral to medial side. And in front of the elbow it is covered by bicipital aponeurosis and medial cubital vein. Posteriorly it is related to triceps brachii, radial nerve and profunda brachii artery. We can remember the posterior relations by using these mnemonics such as JRP. Medially, in the upper part, it is related to ulnar nerve and basilic vein, and in the lower part, it is related to median nerve. Laterally, it is related to coracobrachialis, biceps brachii, and median nerve in the upper part, and tendons of biceps brachii at the elbow. At the elbow, the structures from medial to lateral side are as follows: median nerve, brachial artery, biceps brachii tendon, and radial nerve on a deeper plane. We can use the mnemonics such as MBBR to remember its order. Now let's see its branches. So first one is muscular branches, which are unnamed: profunda brachii artery, superior ulnar collateral branch, nutrient artery, inferior ulnar collateral or supratrochlear branch, terminal branches, that is radial and ulnar arteries. Now let's see about profunda brachii artery. It arises just below the teres major and accompanies the radial nerve. The superior ulnar collateral branch arises in the upper part of the arm and accompanies the ulnar nerve. Inferior ulnar collateral or supratrochlear branch. It arises in the lower part, takes part in the anastomosis around the elbow joint. And the brachial artery ends by dividing into two terminal branches, that is radial artery and ulnar artery. Now let's say about the anastomosis around the elbow joint. It linked the brachial artery with the upper ends of the radial and ulnar arteries. It supplies the ligaments and bones of the joint. It can be subdivided into the following types: in front of the lateral epicondyle of the humerus, anterior descending, that is radial collateral branch of the profunda brachii, anastomosis with radial recurrent branch of the radial artery. Number 2. Behind the lateral epicondyle of the humerus, posterior descending branch of the profunda brachii artery, also known as middle collateral, anastomosis with interosseous recurrent branch of the posterior interosseous artery. Number 3. In front of the middle epicondyle of the humerus, inferior ulnar collateral branch of the brachial artery, anastomosis with anterior ulnar recurrent branch of the ulnar artery. Number 4. Behind the middle epicondyle of the humerus, superior ulnar collateral branch of the brachial artery, anastomosis with posterior ulnar recurrent branch of the ulnar artery. Now let's see its clinical anatomy. The brachial pulsations are felt or auscultated in front of the elbow joint, medial to the tendons or biceps for recording the blood pressure. Brachial artery can be compressed most favorably in the middle of the arm, where it lies on the tendons of coracobrachialis. Occlusion or laceration of the brachial artery. The arm has a relatively good anastomotic supply. This means that it is well protected from ischemia in cases of temporary or partial occlusion of the brachial artery. However, if the artery is completely occluded or severed, the resulting ischemia can cause necrosis of the forearm muscles, Muscle fibers are replaced by scar tissue and shortened considerably. This can cause a characteristic flexion deformity called Wolfman's ischemic contracture. Now let's see about the palpable arteries in the body. So these are the common carotid artery. This is brachial artery, radial artery, abdominal aorta, femoral artery, popliteal artery, dorsalis pedis, and posterior tibial artery. Now let's see the course and relations of the brachial artery. So the brachial artery is the continuation of the axillary artery. It extends from the lower border of teres major muscle to a point in front of the elbow, just medial to the tendons of biceps brachii. It runs downward and laterally in front of the arm. It crosses the elbow joint and ends at the level of neck of the radius in the cuboidal fossa by dividing into two terminal branches, that is radial artery and ulnar artery. Anteriorly in the middle of the arm, it is crossed by the median nerve from lateral to medial side, and in front of the elbow joint it is covered by bicipital aponeurosis and medial cubital vein. Posteriorly, it is related to triceps brachii, radial nerve, and profunda brachii artery, whereas medially in the upper part, it is related to ulnar nerve, and in the lower part, it is related to median nerve. Laterally, it is related to coracobrachialis, biceps brachii, and median nerve in the upper part, and tendons of biceps brachii in the elbow. At the elbow, the structures from medial to lateral side are given as median nerve, brachial artery, biceps brachii tendon, and radial nerve. We can remember this by using a mnemonic such as M, B, B, R. Now let's see the branches of the brachial artery. First one are the muscular branches which are unnamed, and then the profunda brachii artery, superior ulnar collateral branch, and here this one is the nutrient artery which supplies the humerus, and this one is the inferior ulnar collateral branch, also known as supratrochlear branch, and the terminal branches which are radial artery and ulnar artery. Now the profunda brachii artery arises at the level just below the teres major muscle, and it accompanies the radial nerve. The superior ulnar collateral branch arises in the upper part of the arm and it accompanies the ulnar nerve. And the inferior ulnar collateral or supratrochlear branch arises in the lower part and it takes part in the anastomosis around the elbow joint. Now let's see about the anastomosis around the elbow joint. So, in front of the lateral epicondyle of the humerus, the anterior descending branch, also known as radial collateral branch of the profunda brachii artery, anastomosis with radial recurrent branch of the radial artery. And behind the lateral epicondyle of the humerus, the posterior descending branch of the Profunda Brachii artery, Anastomosis with the interosseous recurrent branch of the posterior interosseous artery, and in front of the medial epicondyle of the humerus, the inferior ulnar collateral branch of the brachial artery, anastomosis with the anterior ulnar recurrent branch of the ulnar artery. And behind the medial epicondyle of the humerus, the superior ulnar collateral branch of the brachial artery, anastomosis with posterior ulnar recurrent branch of the ulnar artery. So here we finished about the brachial artery. If you guys find out my video effective, then please like, share and subscribe for more videos. Thank you.